As we shall see, depending on the extent of the patient's disease, there are a variety of treatment options. The cardiologist will perform the angiogram, discuss the results with the patient, and recommend a course of action. This could include PCI, percutaneous coronary intervention, which might include balloon angioplasty or stent placement, or the patient could be discharged and treated later. Generally, until an angiogram has been performed, the cardiologist doesn't know what treatment is best suited to the patient's problem. If a follow-up procedure is decided on, the patient must be prepared to spend additional days in the hospital. Coronary angiography may be used as a diagnostic aid for patients with unstable angina, an abnormal treadmill test, valvular heart disease, acute myocardial infarction, cardiomyopathy, or heart failure. The following information can be obtained by performing a coronary angiogram: the location of any blockages in coronary arteries or in grafts, an estimate of how well the heart muscle contracts, an evaluation of the function of the heart valves, pressure measurements inside the heart chambers, and the presence of any congenital heart abnormalities. Angiograms help the cardiologist determine the best treatment plan for the patient, including continued medical management, PCI or percutaneous coronary intervention, stent placement, or coronary artery bypass graft surgery. The first step in preparing a patient for an angiogram is to review the procedure with the patient and obtain signed consents for treatments. The angiogram consent covers fixing anything that may be found and contains PCI, stent, arthrectomy, etc. Also signed is a consent for coronary artery bypass grafting, in case there is an emergency situation. The surgical consent also has a blood consent. Any tests that have been ordered should also be reviewed, and the cardiologist notified of any abnormal results, such as elevated creatinine or elevated INR levels, which may cause procedure cancellation. Tests usually include EKG, chest X-ray, complete blood count or CBC, sodium-potassium coagulation studies such as INR and PTT, and a screen for kidney function such as BUN and creatinine levels. Assessing kidney function is important because the contrast medium used during the procedure places an additional burden on the kidneys, and in fact may cause kidney damage. The patient's admission history and physical assessment should be completed, and a history of any current medications and allergies obtained. During the physical assessment, a mark is usually made at the sites where pedal pulses are palpated with a skin marking pen. If you are unable to palpate a pulse, a Doppler stethoscope should be used to locate one. If lower extremity pulses are absent, it is important to document that fact and notify the cath lab nurse of this finding.